I want us to listen very well. You know, when we bring this kind of service to someone's office, they may say, we don't need it, so these people are disturbing us. So, but when you come to the hospital to assess it, we'll now tell you what to pay. So she's going to tell you the signs you're going to, when you see those signs, you will know that you're about to develop cervical cancer or breast cancer. So the best thing, whether I'm give or not, treat two of you should go for treatment at the same time and you get rid of it.
Cancer is the cancer that occurs in the cervix. Ebe ka a na-akpọ cervix. Cervix is that opening, a cylindrical opening in your between the uterus and the vagina. Ebe anyị si amụ nwa, or ebe a na-akpọ cervical cervix. So cervical cancer occurs there because most people rarely amaro the symptoms. So when you see such symptoms, they will relax. Cervical cancer na-eme nwoke, also ụmụ nwanyị. So most times we might not know all through sexually transmitted, always sexually transmitted infection. So the symptoms na most times women have vaginal bleeding. You might just have vaginal bleeding, you take it like it's nothing. I see na nke a bleeding na agbakwa m, afụchagokwa m period. You don't want to do anything about it. There is a problem and you need to identify what the problem is. You need to see your doctor. Jegwa doctor. And when you nigga say, maybe all fibroid, because there are a lot of fibroid na cause nje bleed, doctor walome. So because of that, you neglect it. Some people go na during sex with their husband, they will have severe pain behind this perineum. And you feel like normal thing. It's not a normal thing. These are the signs, the things you look at, and you'll be like, no, there's a problem somewhere and it needs to be sorted out. So when you have these symptoms, you should have it at the back of your mind that all is not okay and you need to visit your doctor immediately. These people libido sex at an early age. You have sexual contact at an early age when multiple sexual partners. We are not just learning for ourselves. We can also tell our children about this, counsel them. Most times girls now, if you're not sexually active, your friends will look at you like you don't you're on all that, but you're predisposing yourself to cervical cancer in future. So these are the things we need to also talk to our girl child, that cervical cancer is real, and the predisposing factor, multiple sexual partners, and early exposure to sex. The preventive measures now, we're going straight to the preventive measures. Like I said earlier, early sex. You talk to your girl child, biko kwa this thing you're doing, you cervical all part of the reasons and enable cervical cancer in future. So when you talk to them, they will have the idea that, oh, this thing I'm actually doing, there's a problem that might come up in future. And not just having sexual partners, most of them have multiple sexual partners. So you talk to them about that, counsel them. Another thing is healthy diet. At our age now, we should know that with age there are some disease conditions, and with age you should know what you should eat. Now enwere ndị na-abịa elie akpụ n'ụtụtụ, elie garri n'efifie, elie rice. So that is not a balanced diet. With age, I know ihe siri ike na Nigeria, but you're also trying to help yourself, because when you do these things, you're prolonging your lifespan. What do I mean? If we tell rice, it's not taking like 4 or 5 scoops of spoons of rice. You should make effort to put in at least vegetable should be more than the rice. Protection is key. So women should know when to do examinations and know when to see their doctor. Thank you.
Mama, and then I go ahead,
You know that prevention, they say, is better than cure. There are some sicknesses that if you discover it early enough, it will be easier for the doctors to handle it, to treat you. So I encourage every woman in Anambra State to make sure that from time to time, according to the directive, you go and run a check to make sure that you are okay. It's better we prevent this sickness than allowing ourselves to get into it and coming out will be difficult. So nobody will want to see what will kill her and still stay without looking for a way of protecting herself. So this protection is here. There is a way out, and that way out is for you to go for a check. They just started it here. They are really doing wonderfully well. And the government of Anambra State right now, under the leadership of Professor Soludo, is as well working towards making sure that we have this good health, especially for women.
Ihe dị maka maka ihe onye ọbụla ga-eme na the screen and the screen na-eme is okay. Eme ma nwoke mee ma nwaanyị mụ nwe mekwugo nke m onye ọ na-amara result ya ma ma ịdị free ma ma ọ na-edọ free ma ma ihe ya ejiji treat ya ha enyekwuzie gị direction ihe gị treat ya maka ihe esi eme.
I must really commend the screening. Screening is ọfụma. Ma ignorance they say is a disease. Ọ ka mma na mmadụ ma ihe ọ na-eme ya ma ọ naghị eme, because early detection is a step closer to the solution of the problem. So dịka ndị a si dị ebe a taa wee screen ya ndị mmadụ ma ọkwa ma alụmọdụkwa ya, fine, it's very nice. So the screening is okay.